So this video is for if you have scoliosis or any spinal malalignments. You know, when you go to the chiropractor and the chiropractor says, oh, your L345 is off balance, or your T2 is way off to the right and needs to be in the middle, you need to make 10 appointments with me. Okay, well, instead, I'm going to tell you what to do. Or for people who have scoliosis, a lot of people were diagnosed with this at a very young age. And I believe that there's a lot of habits of the way that we use ourselves that goes into contributing towards our scoliosis. And the good thing about that is we could retrain ourselves back into balance. So for this Feldenkrais lesson, I'm going to walk you through. All you need is a small pillow for your head and a rug or a mat to lie upon. I'm going to just demonstrate here on my table. My dog is, of course, going to join me. He's got separation anxiety. So just for a moment, I encourage you to start off by just laying down on your back. Go ahead and do that. Lay down on your back and imagine drawing an imaginary line down your spine. Like as if my finger was at the very top of the back of your head and I was going down, down slowly, vertebra by vertebra. What would that line look like? Would it be zigzagged or more off to one side, more off to the right, or more off to the left? Go slow, vertebra by vertebra. Noticing how all of your spinous processes are. The spinous process is that part that points out that you could actually feel as if you're touching your back. You could also imagine as if you're lying on a balance beam, and the balance beam is lined up with your spine. And which way would you fall off towards? More the right or the left? Okay. And I'm asking you to notice this because in this lesson, it's all going to shift. Okay, so get a really clear picture as to what your spine looks like. Also notice, is your nose and head more to the right or more to the left? And just notice what your preference on how to hold your head and nose is right now. It's okay that you have preferences. We all do. Nobody's symmetrical or aligned. We all tend to look one way. Most people like to look more to the right. Our nose is more to the right because we're right-handed. However it is, it's fine, okay? So once you've done that body scan, then I invite you to lay down on one side. I'm going to lay down on my right side because that's how the camera's set up here. So I'm going to go ahead and lay so my back is to you. And you want to have both of your palms touching one another and your knees stacked one on top of the other. And very gently, you're going to slide the top hand along the bottom hand. And go nice and slow. Do this in a way that you could just ever so slightly feel your shoulder blade sliding in the direction of your hand. And then as you come back, notice how it comes back towards your spine. Go nice and slow, noticing what vertebra of your upper back are involved in this movement. Nice and slow forward, nice and slow back. Keep doing it a few more times. Now, everything in Feldenkrais, you want to go nice and gentle. Don't force it. This isn't about the number of repetitions that you're doing at the gym. Make it nice and slow and easy. And if anything you're doing hurts, stop. And you could literally just think through the motion. Just thinking through the movement will be enough. So go nice and slow forward and back, forward and back, and then just pause and take a rest. So what we did is we just freed up this area here, got some mobility going in our upper back area. And now we're going to do the same thing with our legs. I'm going to invite you to very slowly slide. Don't lift, don't force, don't push. Your upper leg against the lower one. Nice and slowly you're going to slide it forward and back. And as you're doing this, keep the area above where my hand is, keep the area of your mid and up back silent and still. So go nice and slow. Now your low back doesn't move as much as your upper back. What that means is you have to go a little bit slower and a little bit less. So you could go ever so small, sliding this part, your pelvis, forward and then back. Do that a few times. Nice and lazy, nice and easy. And then stop and take a break. Now next, we're going to do the same thing with the hand and the knee. So I'm going to invite you to slide both the hand and the knee forward and then back to the start. Slide them together forward and back to the start. Do it a few times. And then pause. So the next thing we're going to do is I'm going to have you slide your top hand on the bottom hand, but you're going to inhibit all of your lower back and lower body. So I'm going to show you what I mean. So now I'd like you to very gently slide that left hand forward just as you did initially, but this time inhibit the movement of your pelvis and your lower back. Hold it stiffly. And at the same time, hold your neck stiffly. So don't allow your neck and don't allow your pelvis to move at all. Allow this movement to be isolated just to the arm. Now, I'd like you to go ahead and include the movement of the arm and of the neck. So what I mean by that is, as you slide your upper hand backwards, your nose goes up towards the ceiling. As you slide your hand forward, your nose goes towards your hand. Equal and opposite timing. So as you slide your hand backwards, your nose looks up towards the ceiling, and then they both come back down together. So just allow your arm and your nose to move as one, to move together forward and back. And then pause with your nose up towards the ceiling and leave your nose up towards the ceiling. But this time just move your arm a few times, slide it forward and back. It's called differentiating. We're differentiating the different parts of ourselves. And then take a rest. And from this rested position, leave your nose where it is, facing towards your hands, and go back to moving just your arm, keeping your head stationary. So just your arm, keeping your head stationary. And now go ahead once again and move your arm and your head together as one, back and forth. One last time, and then take a rest. Now we're going to focus on your leg, and we're going to differentiate it from the movement of the arm. So what I'd like you to do is very gently slide your left knee, your top knee forward, and then as you bring it back to the start, slide your left arm forward, and vice versa. So equal and opposite timing. As one limb goes forward, the other one goes backwards. So as your left arm slides forward, your left leg goes back. Continue like this a few more times. And then pause, take a rest. Anytime if you get tripped up in these movements, just pause, take a rest, and then come back to them when you're ready. And now we're going to take the arm and leg together, slide only the left. Nothing is moving on the right, only your left. And slide it forward and back. And as you're doing this, keep your head stationary, so don't move your head. And now, go ahead and allow your head to move. Go ahead and allow your head to roll with your arm and leg. And how is it that it would want to move? Okay, take a rest. Take a breath. You're welcome to slow this video down, to take more pauses. The pauses allow the nervous system to integrate the change. And now I'd like you to keep your arm and your shoulder quadrant silent. And now just the leg and the head are going to move. So I'd like you to slide your left knee, left leg forward as your head turns to the right. As your leg comes back to the center, your head turns to the left. As your leg slides forward, the head turns to the right. As your leg slides back, the head goes back towards the ceiling. Slide your leg forward, head rolls to the right. Slide your leg back. Go a few more times like that. And then pause, and the next time, go ahead and involve your arm now. So that means you slide your arm and your leg forward and your head rolls to the right. And then slide everything back and the nose goes towards the ceiling. Go forward and back. Forward. A few more times, sort of like you're rocking a baby. And go a little bit bigger. Go a little bit bigger. And the next time you slide your arm and leg back, go ahead and roll onto your back. And take a rest on your back. Remove the pillow. Lay with your legs long. Unless you have back pain, then bend your knees. And now notice how that imaginary line is that I had you draw initially from the back of your head all the way down to your tailbone. And notice how you're lying on that balance beam now. And notice the direction your nose is pointed. Now you might notice if your nose was pointed to the right initially, it might be pointed to the left. So some things have shifted. So now I encourage you to rewind this video and lay back down and do the same thing on the other side. And then when you're all finished, come up nice and slow. The way to come up is use your upper hand and your hand and your upper arm and push yourself up at the same time as you slide your legs and feet off the table like that. And when you're all finished with both sides, take a moment, feel yourself first in laying and then in sitting, and then go for a walk and feel how symmetrical you now feel. I welcome any comments below about how this video was for you. And I'd also love to hear what videos, what kind of content would you like to hear more of? And have a great rest of your day.